ACW is sponsored by HpDMS. Self-care through skincare. HpDMS is for everybody. Welcome to ACW Podcast. I am Robin Gabriel-Parson, your host. I'm truly excited about our topic discussion today. And I'm especially excited about our co-host, Claudean Capers. Claudean Capers will share with us her journey with breast cancer. She has such a unique story, and I hope what she shared with us today will motivate and encourage anyone living with breast cancer to continue the fight. Do not give in. So listeners, sit still, and we'll be right back. We honor and thank everyone in the fight for social justice. Teachers, healthcare workers, and all of you in high-risk jobs. We know it's stressful, so we have a gift of thanks from us to you. For more information, visit HpDMS.com. That's JABODIBODY.com. You are listening to ACW Podcast. Our topic today is living and thriving with breast cancer. Our co-host is Claudean Capers, and I want to extend a big thank you to Claudean for being transparent and sharing her story with us. Thank you again, Claudean. October is Breast Cancer Awareness Month, and our topic for the month of October is living and thriving with breast cancer. Now, we started our conversation last week with Dr. Gary Gabriel, life science expert, and Dr. Gabriel left us with so many life-changing nuggets that can help family members, friends, or someone you may know who is living with a breast cancer diagnosis. Now, we are continuing our breast cancer discussion today with our special guest and co-host, Claudean Capers. She is a breast cancer survivor. Now, Claudean Capers' story is an example of how breast cancer is affecting our communities. Now, during our podcast with Dr. Gabriel, he provided us with a list of wellness actions we can implement to combat breast cancer. And we're going to revisit those today, and we'll talk more about that. So stay tuned.
Hi, my name is Claudean Capers. I'm from New Orleans, Louisiana, and I'm 45 years old and a breast cancer survivor, and want to share a little bit about my fight with breast cancer. I'm going to take you back in my past and give you a little history about when I was first diagnosed at the age of 12, and I'm going to bring you up to what I'm dealing with, my health currently. At the age of 12 years old, I was pushed down at recess at school and was sent to the school nurse. My mother was called to the school, and before she arrived, the school nurse asked me if my knee hurt, and I said, no, my chest hurts. It hurts right here. And I remember pointing to the same area I had been telling my mother for the past 4 or more months that I could remember. I even remember going to the doctor for my checkup by my pediatrician, and my mom told her about my complaints, but she didn't see anything and asked me if I fell or hit myself in the chest, and I told her no. So the doctor blew it off. So my mom asked her again, and she said, I don't see any bruising or anything. She said if she have any complaints, just bring her back. So anyway, before my mom reached the school, I remember the nurse saying, the nice paramedics are going to check you out, okay, until your mom gets here. And I'm like, okay. Then my mom walked through the door, and off to the hospital we went. First to Charity Hospital where my mom worked. Then they checked me out and referred me out to see Dr. Burnell at Methodist Hospital in New Orleans East. I remember during the consultation and my first appointment with him when my mom brought me, he told my mom she may never have breasts. I was only 12 years old, 85 pounds and bones without any breasts yet. And the first thing I did was cry, cry, and cry. My mom said, everything will be okay. And I said, no, it is not okay. It will not be okay. I will not have breasts like my big sister. That is not okay. And I'm sad. Long story short, I went to surgery 3 days later. And my sister was there to support me too. She was 4 years older than I. And I had 8 lumps removed from my right breast.
You are listening to ACW Podcast. I am Robin Gabriel-Parson, your host. Our co-host is Claudean Capers. Our topic today is living and thriving with breast cancer. We started our conversation last week with Dr. Gary Gabriel, and Dr. Gabriel left us with some very interesting nuggets. I call them wellness actions, and these wellness actions are actions that you can implement as a breast cancer survivor, patient, caregiver, or someone who is dealing with any form of cancer. So get a pencil, and I'm going to give you this wellness action list. So, number 1, wellness action. Early diagnosis. Very important. Now keep in mind, remember, Claudean Capers' story started as the age of 12. She was diagnosed with cancer at the age of 12. And she was diagnosed accidentally. So early diagnosis is very important. Support group is another wellness action. Identify a support group that can help you along this journey. It could be an interfaith family. It could be a community. But find that support group that's going to help you in a positive way. Nutrition. Very important. This is another one he brought up. Eating healthy. Making sure you're intaking fruits and vegetables. And water. Staying hydrated. Because you have to build that immune system. Especially if you're taking chemo. Exercise. It's very important to exercise. Find an exercise that you enjoy and participate in it. It helps you trigger those happy endorphins. Mental health was another wellness action. Very important. Cancer affects the mind in a very negative way. So it's very important that a cancer patient find an activity where they can release any anxiety or depression. Activities such as yoga or mindful meditation, swimming, something that will relax you. But most of all, it's the call to action for everyone to help anyone that is dealing with any form of cancer and having that knowledge. And also keep in mind, women of color has the highest risk of dying from breast cancer than any other ethnic group. ACW is sponsored by Jabati. Self-care through skincare. Jabati is for everybody. You are listening to ACW Podcast. I am Robin Gabriel-Parson, your host. Our co-host is Claudean Capers. Thank you, listeners, for tuning in. Today, our topic is living and thriving with breast cancer. Our special co-host that we're highlighting is Claudean Capers from New Orleans, Louisiana. Ms. Capers has provided us with a recording of her story. Unfortunately, the day that I was to record with her, she had chemo and she wasn't feeling that well. But I appreciate that she took time and recorded this and shared the story with us. So, listeners, I hope this story encouraged you, and if you have family or friends dealing with it, hopefully this will motivate you to continue encouraging them to live and thrive with a diagnosis of breast cancer.
After that, recovery was the worst. for a 12-year-old. Nothing could have prepared that for me at all. I also healed and went on after chemo and thought that was the end. I had no further education on anything. If you can get breast cancer again, can it come back somewhere else? Does your body change after chemo or have side effects to your body? Are there things to avoid like food or chemicals? No one came to my mother or my family and taught them anything or said anything in the 80s. So here I am, still asking questions later on. So as time went by and I got older, I still had fatty tissues or lumps and still was getting mammograms. So I was seeing another doctor at Oxnard Hospital in 2012. And so at main campus in New Orleans, Louisiana at Oxnard, I had a Dr. Chris Theodosius over at Oxnard. He sent me to have a study done over in the genetics department. So they did some genetics testing done, and they also did some autoimmune testing too. And so they actually go back and ask you some questions, and they further did some tests that was done that just go all the way back, and they'll ask you about your parents first. And one question was asked about your mother, your grandmother, anybody in your family who have cancer. And one thing I told them, my grandmother died early on, my mom's mom, and she died because she had an ear infection, and I think later they found out that she had cancer like in her neck. And so once I got her records verified that. And then my mom had like a cancerous tumor removed from her stomach. She never had breast cancer though. And then my sister, that's 4 years older than me, at the age of 18, she had cancerous, her milk duct glands was cancerous. And then I also have a sister that's almost 10 years younger than me. She have, every time she was pregnant, she had tumors and cysts that grew with her babies. And then I have another, and then my oldest sister, she couldn't have kids. And I have a younger sister that's 12 years younger than me, and she could never have children. So it's like a pattern that goes on and on and on and on.
ACW is sponsored by Jabati. Self-care through skincare. Jabati is for everybody. You are listening to ACW Podcast. I am Robin Gabriel-Parson, your host. Our co-host is Claudean Capers. Now, Claudean Capers is from New Orleans, Louisiana, and her story is uniquely different. She is a breast cancer survivor, but she has a very special story that I'm hoping everyone can relate to. And I want to thank Claudean for being open and sharing and being transparent with her journey. So thank you, Claudean. Now, Claudean was diagnosed with breast cancer at the age of 12. You rarely hear about a child being diagnosed with breast cancer. And not only that, I cannot even imagine the mental, physical, and emotional effect a breast cancer diagnosis has on a 12-year-old child.
So it's a genetic thing that went from my grandparent to my mother, and from my mother it came to her girls. And it's weird because even from me, I passed that on to my son. So with my son even had colon cancer. Crohn's disease. So he doesn't have any children, and he's only 29. And I pray that, that don't go and stop his life from having kids, because he had to go through treatments for that. But even having chemotherapy, you have things that you actually go through for that. And my sisters and we all been tested for the BRCA test. So that could be inherited through genetics. And my sisters already been told that they should all actually have the surgery, and they should go, and they already been told that they should consider having their breast removed. So they making those decisions to do so. And that's up to them. Another thing, my mom suffered with having cysts. That's another thing that's African American women is very genetic too with that, and it's associated a lot with that, with breasts. During breast cancer, women go and have mammograms, and you'll see a lot of fatty cysts that's not cancerous, a fatty tissue and cysts, a little tumor cysts, look cystic, and they're not cancerous, but you'll see them a lot in Latinos and Black women. That's very, very common also. And my grandmother had them, and all of my sisters have them, and even I have them. And they're really, 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 really common, and they're very, very, very genetic in families. They're very, very genetic. So that's something that you can see a lot in women. In the 20s, and in the 2000s, and finding out that why do I have scarring on my heart, and problems with my liver and bones are not strong, and I'm sleepy all the time. My immune system is not strong, and why do I have autoimmune disease, which means that the body attacks its own cells and organs, including the skin, joint, heart, lungs, blood, kidneys, and brain, all from chemo, which is made up of different chemicals to fight cancer for you to live. I fought at 12 years old, then at 21 years old, and then in 2012. I educated myself, and I will continue to educate myself. And I will continue to fight and continue to have the will to fight and have the faith and the will for God, for others. This is my story. I will continue to have a story for myself and for others, that I am in remission right now, in spite of anything, and in spite of all. Keep your head up, stay strong, keep those gloves on, continue to fight. Keep those pink gloves on and continue to fight for yourself, for other women, and men also can get breast cancer. This is breast cancer month, but breast cancer is 365 days a year, ladies and gentlemen. This is my story of being a survivor. Let's survive together.
Wow, Claudine, thank you so much for that story. I can begin to thank you for your transparency and sharing a part of your life journey with us. Thank you, audience, for listening in today. We hope our Breast Cancer Awareness Podcast has provided breast cancer patients and survivors and caregivers with a sense of encouragement, empowerment, and enlightenment. So, audience, please join us next week on Wellness Wednesday. We will continue our discussion about breast cancer. Our special co-host next week is a health and wellness professional. Her name is Stephanie Jones. She is not only an advocate for breast cancer, but she's a fitness and wellness professional who has designed health and wellness programs that assist breast cancer survivors and patients with living their best lives with a diagnosis. Her programs are designed around exercise, proper nutrition, mindful therapy, and massage therapy. So I'm looking forward to talking to Ms. Jones next week. So listeners, tune in. Until next time, live life with purpose, intention, and love. You have been listening to the Awareness, Culture, and Wellness Podcast. We thank you for joining us, and we hope that you tune in to our next Wellness Wednesday as we discuss topics that heals the mind, body, and spirit. Until next time, I'm Robin Gabriel-Parson, your ACW podcast host. Really pissed at you so much. ACW is sponsored by Jabati. Self-care through skincare. Jabati is for everybody.